Hello, I'm Dr. Brian Moran at Chicago Prostate Cancer Center, here with my patient Reg. And Reg is a remarkably intelligent and active 55-year-old gentleman who was recently diagnosed with prostate cancer last year. He had intermediate risk disease and was evaluating his treatment options. Active surveillance was not a good option for Reg at his age and the type of disease he had. So we took care of Reg, and he is now 4 months out since treatment.
6 months.
6 months out since treatment, and he's done beautifully. His PSA level is very low today. It's continuing to decline. His quality of life is excellent. He's off all his medication, and it's just a good story. When I saw Reg in follow-up, I'd ask him if he'd share his experience with you.
Well, the experience has been amazing. It's been so good that I was actually worried coming in today that my PSA numbers would be high because I've had very, very minor side effects, and the overall process here was just unbelievable. Yeah.
So you had surgery as an option, Reg. You had external beam radiation, plus or minus hormones, and then obviously brachytherapy.
Right. The decision for me on the brachytherapy was, my wife and I made that around my particular pathology, and I talked to all of my friends about understanding what your baseline PSA numbers are, or at least establishing one, and what's your pathology, how aggressive is your cancer. The one thing you suggested, doing the Prolaris test.
Right, I'll mention that. Prolaris is it's a cell cycle proliferation marker that we have been using more recently to identify which patients in the intermediate risk category require monotherapy, or if we need to be more aggressive with a combined approach, adding external beam. And in your case, your genetic profile was favorable. So this is something that's new that we are actively using to decide upon treatment courses.
Yes, and I think that's very important because I have prostate cancer history with my grandfather, so I was concerned coming into this and what that genetic markers might look like, and so having it come back as non-aggressive made me even more comfortable with the brachytherapy.
Great. Well, it's just another great story, and I think Reg is really great proof of the efficiency and the efficacy of this treatment and its ability to maintain quality of life.